even though the temps are warming up a bit this weekend and early next week, those frigid temperatures will return late next week. And that means there's always the possibility when you're outside of getting frostbite.
Joining us right now to talk about it and how to prevent and treat it is Dr. Robert Sheridan with the Boston Shriners Hospital for Children. Thanks for joining us.
Thank you for having me.
First of all, what is the scientific part of this? What exactly is frostbite when it comes to the frigid cold in your skin?
Well, frostbite has a huge range of severity, but when it's severe, the physiology really is freezing. The blood vessels, the little small blood vessels will freeze, and when they thaw, the lining of the blood vessels breaks and causes the blood to clot in those small blood vessels, removing the blood supply to the body parts that are affected and resulting in their death.
How easy is it to get frostbite when you're out in the cold, and what are some warning signs?
Great question. One of the big factors that results in frostbite is that as we get generally cold, get hypothermic, our thinking gets impaired and our judgment gets impaired because our brain cells don't work very well when they're cold. And that, combined with the fact that once a body part gets really cold, the sensation goes away. It hurts at first and then it doesn't hurt, but the freezing is still going on. So your inability to recognize the trouble you're in, and then your inability to really feel it, is what results in the more severe frostbites.
Is there a certain temperature or wind chill that we need to watch out for, or a certain amount of time being outside in the elements?
I mean, all those things contribute. Time contributes. How wet the tissue is, how wet the clothing is, contributes. If the patient has had prior cold exposures or prior minor frostbite, sometimes there's damage, that's generally not noticeable until they're cold again to some of those small blood vessels. So prior exposures will hurt it. Smoking makes it a bit worse. So there's a lot of factors that contribute, but certainly, just the raw temperature and the duration of exposure are the big ones.
Are children more at risk when it comes to frostbite, and if so, why?
Particularly young kids, their body parts are not as well insulated. Their little fingers the cold can penetrate quicker. They may not be able to express themselves. They may just have some general distress, but they're not going to say, if they're a young toddler, for example, my fingers are freezing. And just like us adults, their processing of the pain is impaired by being generally cold, and their sensation of the pain gets less as it gets more severe. So in those ways, yes. And also, especially younger kids are really dependent on us adults to make sure their gloves are still on, to make sure they haven't been out too long and just can't express the fact that they're in pain.
Can pets get frostbite?
What a great question. I suspect yes. Nobody's ever asked me to take care of a pet that's had frostbite, but I don't see why not. I think animals in general are better built for exposure to cold. They have fur on their hands, but I would expect, yeah, I don't see why not.
When it comes to prevention, besides not being outside for a long period of time, what else can we do?
I think that the most important factor is don't go out in extreme cold alone, and take care of each other. Watch out for the people you're with. Take a look at their face and their nose and make sure that they are not getting dusky or pale, those body parts. You can tell when your friends are maybe not thinking and judging as they normally would by your interactions with them. So really just watching out for each other is really important. And I think that's reflected in the fact that at least we don't see that many wilderness adventurers, well-trained outdoorsmen coming in with frostbite unless there's been a catastrophe, because they're well-trained, they have the right equipment, they know what to look out for, they know how to pace their cold exposure. Whereas those of us who don't spend a lot of time in the cold for extreme recreation don't have those skills and don't have that equipment, and so we're more likely to have that happen.
Well, unfortunately, once you do get frostbite, how long does it take to heal?
Well, that depends. I know that's always the hard thing to say, but the range of severity is so enormous, from just a little bit of a blister that'll heal in a few days to, a necrotic, a dead, extremity that will separate or be removed surgically and require a lot of surgery and rehabilitation to get a functional result. So it can be anywhere from days to months.
And is there a
And they
website?
don't all heal. Some of
Okay.
them are irreversible tissue loss.
And is there a website where people can, find out more advice, and especially for parents as well?
Yeah, let me just check that website. I can find that for you. And the other thing I would say is, general impairment due to fatigue, due to the use by anybody in a party out in the cold of an intoxicant, can really impair judgment. And I think your ability to be aware of your surroundings and aware of what your body's telling you is probably the most important part of all of this. So the website I can give you is shriners.boston.org, and that's the website to the hospital here, which has links to frostbite and other things.
Sounds great. Well, doctor, we appreciate your time. Appreciate all the tips and advice.
Well, take care, and you have a wonderful day.
You too.
Stay
Thanks
warm.
so much.